This medication is prescribed to help with certain types of cancer such as diffuse large B-cell lymphoma, DLBCL, and high-grade B-cell lymphoma. Epcoritamab-Bysp works by slowing down or stopping the growth of cancer cells. Before starting epcoritamab, it's important to read the medication guide provided by your pharmacist and ask your doctor or pharmacist any questions you may have. This medication is administered by injection under the skin of the abdomen or thigh by a healthcare professional. Your doctor will start you on a low dose and gradually increase it to reduce the risk of side effects. The initial doses are part of a step-up dosing schedule. After the first full dose, you will need to stay in the hospital for 24 hours so your doctor can monitor you closely and help manage any side effects. The treatment schedule is tailored to your medical condition and how you respond to treatment. Before receiving this medication, your doctor will prescribe other medications to help prevent side effects, such as acetaminophen, prednisolone/dexamethasone, and diphenhydramine. Additionally, other medications like antibiotics and antivirals may be prescribed to prevent infection. It's important to carefully follow your doctor's directions for all your medications. Using this medication regularly will help you get the most benefit from it. You can mark your calendar with a reminder to help you remember to take it. Some common side effects of Epcoritamab-Bysp 4 mg per 0.8 ml subcutaneous solution, must dilute, may include tiredness, stomach pain, diarrhea, nausea, muscle/joint pain, bruising, redness, itching, or swelling at the injection site. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. Serious side effects may also occur, but you have been prescribed this medication because the benefit to you is greater than the risk of side effects. Your doctor will monitor you carefully to decrease your risk. Contact your doctor immediately if you experience any serious side effects such as easy bruising/bleeding, signs of anemia, such as unusual tiredness, pale skin, or any signs of infection, such as sore throat that doesn't go away, fever, chills, cough. In rare cases, a very serious allergic reaction to this drug may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you experience symptoms such as fever, chills, headache, fast heartbeat, trouble breathing, unsteadiness, or dizziness/lightheadedness, it could be a serious side effect known as cytokine release syndrome (CRS). Make sure to inform your doctor immediately. Additionally, this medication may also cause rare but serious nervous system problems. If you notice any symptoms such as confusion, drowsiness, changes in your handwriting, shaking, trouble speaking, seizures, or memory loss, it is important to seek medical attention right away. Before using epcoritamab, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause allergic reactions. Also, be sure to discuss any current or recent infections with your healthcare provider. This medication may cause dizziness, drowsiness, or affect your thinking and coordination. It's important to avoid alcohol or marijuana, as they can worsen these effects. Make sure to avoid driving or using machinery until you know how this medication affects you. Also, talk to your doctor if you are using marijuana. Epcoritamab can make you more susceptible to infections or may worsen current infections. It's important to stay away from anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. Talk to your doctor if you have been exposed to an infection or for more details. Before receiving any immunizations or vaccinations, make sure to inform your healthcare professional that you are using epcoritamab. It's also important to avoid contact with people who have recently received live vaccines, such as the flu vaccine that is inhaled through the nose. If you are pregnant or planning to become pregnant, it's crucial to talk to your doctor. Epcoritamab may harm an unborn baby, so your doctor should order a pregnancy test before you start this medication. Be sure to ask about reliable forms of birth control while using this medication and for 4 months after the last dose. It's unclear if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding while using this medication and for 4 months after the last dose. And as always, before having surgery, make sure to inform your doctor or dentist about all the products you are using. When taking Epcoritamab-Bysp 4 mg per 0.8 ml subcutaneous solution, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of experiencing serious side effects. It's essential to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Epcoritamab-Bysp 4 mg per 0.8 ml subcutaneous solution. Always consult with your healthcare provider before making any changes to your medication regimen. If you or someone else has taken too much Epcoritamab-Bysp 4 mg per 0.8 ml subcutaneous solution, must dilute, and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. When using Epcoritamab-Bysp 4 mg per 0.8 ml subcutaneous solution, it is important to undergo lab and/or medical tests, such as a complete blood count. Make sure to attend all medical and lab appointments and consult your doctor for more details. It is important to keep track of your health while using this medication. Now, let's talk about the dosing schedule for Epcoritamab-Bysp 4 mg per 0.8 ml subcutaneous solution. It's crucial to take each dose as directed by your doctor. If you happen to miss a dose, make sure to consult with your doctor or pharmacist to determine the best course of action for a new dosing schedule. Remember, consistency is key when it comes to taking this medication. This medication is typically administered in a medical setting, such as a hospital or clinic, and is not meant to be stored at home. It is important to follow the instructions of your healthcare provider when receiving this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.